Welcome to the City of Toronto's COVID-19 media briefing for Monday, May the 4th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor?
Well, good afternoon and thank you, Brad. And I'm happy to announce today that the city will be opening our community gardens and our allotment gardens. This comes on the heels of a provincial decision on community and allotment gardens in which we cooperated with provincial authorities, and I thank Premier Ford and his government for this step forward for people. This is good news for residents who use these gardens, and it's good news for everyone who wants to see us getting on with restarting and reopening the city, always within the context of what's solid in public health terms. This is an important step in that process. Park staff have been working with Toronto Public Health to map out a way to reopen the city's 81 community gardens and 12 allotment gardens safely since the province changed the emergency orders to allow for their opening. These gardens are very important to the residents who use them, and I'm glad that we've been able to find a way to get them up and running now just in time for the planting season. Each year, the city's community gardens and their volunteers alone support more than 25 community agencies and provide between 1,133 to 2,267 kilograms, 2,000 to 5,000 pounds of fresh Toronto-grown produce. Annually, more than 1,300 people use the city's allotment gardens to grow their own food and plants. The gardens typically open at this time of year for planting activities, but were previously included in the province's ordered closure of all recreational amenities in the province of Ontario. When they allowed the reopening, the province directed local medical officers of health, including our own Dr. de Villa, to provide advice and instructions that gardens must meet in order to operate safely, both for the benefit of those using the garden and for the benefit of the general public. These instructions include detail on how to achieve physical distancing at these locations and guidance on the cleaning and disinfection of shared equipment and surfaces. I know that Toronto Public Health staff and staff from Parks, Forestry and Recreation of the city have worked diligently to protect public safety at the gardens while providing access for Torontonians to an essential source of fresh local food. And I thank them for all of their efforts in that regard. We have worked to get this right. Like everything we've done, it is about protecting the health of people, saving lives, and doing so in a sensible, balanced way. Garden plots in the city's allotment gardens are within close proximity to one another, and many resources, including water service and equipment, are shared to make the best use of space for an extremely popular city program in an urban environment. To date, 1,357 allotment garden permits have been issued for the 2020 season. So you can see a large number of people are involved in this, often groups of them within relatively small spaces. And due to that tight space and the volume of people who hold the seasonal permits, there are challenges for physical distancing as well as regular cleaning and disinfection standards that must be met. The city's community gardens are initiated through proposals from local community groups for unused green space. As such, they are designed spread out amongst Toronto's many different communities. And they are also operated and organized by volunteer groups who can, to a certain degree, self-organize and self-regulate to ensure that they meet both provincial orders and on gatherings and public health guidelines. It is for these reasons that the city is taking a phased, responsible approach to opening its community and allotment gardens. You can expect to see community gardens begin to open on a location-by-location basis this week, followed by allotment gardens next week. Signage at each location will identify the expectations for use, including the practice of physical distancing and good hygiene, and staff will share public health measures as well as expectations and guidelines with the permit holders and community groups directly. We are working closely with our many community organizations and permit holders to ensure that they can regain access to community and allotment gardens and ensure as well that they and our staff remain safe and healthy at all times. We will be watching how this reopening works and using it to help guide future activities of this kind. If public health is our top priority, which it must be, we can all work together to reopen as quickly as possible, but it may not always be possible to reopen quickly. Much of this will rely on personal responsibility, people doing the right, responsible thing in these gardens and elsewhere as we take further steps together. And we know the vast majority of people are doing the right, responsible thing and practicing physical distancing when they're out and about. This past weekend, we had the first nice, sunny, and warm Sunday. People were out and about, but they were also keeping their distance from others. It was reasonable to expect people would be out, but important for them to keep their distance, which the vast majority did. Only 4 physical distancing tickets were issued across the whole city, a city of 3 million people, on that first glorious day of temperatures above 20 degrees since October of last year. And for that, I simply say thank you for that cooperation. Thank you for following the advice that we've given so often. People are getting it, and that is helping us to save lives and to stop the spread of COVID-19 and bringing us closer to that promised land of reopening as long as we keep up the good work. Many residents also understood why we closed High Park, to prevent large crowds from gathering, as they have in many previous years, to see the cherry blossoms. And thousands of people, as requested, kept away from the park this weekend. Even those who did pass by the park seemed to understand, and for that I say thank you again. And that includes local residents who've been very understanding of the decision to close the entire park. All of these people are taking personal responsibility for physically distancing while still trying to have a life of sorts during these unprecedented times, and they are helping in the war effort against this deadly virus. I look forward to the opening of both the community and the allotment gardens, and I thank the residents who use them for the good work and service that they provide for their families and for the community's food security. This is another sign that while the fight against COVID-19 continues, we are working to find ways to get back as much of our normal lives as we can. I have my sights firmly set on that goal on your behalf. And now I would ask Dr. Eileen de Villa, the Medical Officer of Health, to give her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As some of you may know, today is the beginning of Mental Health Week. And when we think about our mental health, the past few months have been difficult for all of us. Our lives have been transformed since the COVID-19 pandemic, and this has taken its toll on many of us. Our daily routines are different, and we aren't able to fully enjoy our city, all our city has to offer, especially on nice sunny days like we had yesterday. I realize that with the nice weather upon us, it is getting more and more difficult to stay at home. And I realize that we need to get out and exercise from time to time. So like Mayor Tory, I will thank all of you who did not congregate in groups, and all of you who practiced physical distancing when you went outside yesterday to enjoy some sunshine and fresh air. For today's update, as of 5 o'clock yesterday afternoon, there were 6,278 people infected with COVID-19 in Toronto. This includes 5,641 confirmed cases and 637 probable cases. There were 387 people in hospital, 105 people in intensive care units. In total, we have lost 449 Torontonians to this virus. On behalf of all of us, I extend deepest sympathies to all who have lost loved ones to COVID-19 and wish a speedy recovery to all those who are sick. Every day, I report these numbers to you because these data tell us how COVID-19 is affecting our city. The analysis of COVID-19 cases, hospitalizations, intensive care admissions, and deaths helps us describe and understand how many people are infected in our city, how the virus continues to spread, and the burden it places on our health system and our healthcare resources. It's important to note that in a pandemic, it's not the data from any one given day that actually makes a difference in our understanding of what's happening, but rather the data patterns and the trends that we see occurring over time. Our data are telling us that we are making positive progress in our city. It is also telling us that we continue to see new people becoming infected with this virus. This means that we are unfortunately still not in a place to ease our public health measures yet. Prior to implementing strict public health measures in mid-March, each case of COVID-19 in our city went on to infect an average of another 3.5 people. This contributed to the growth of the outbreak and the climb in our outbreak curve. In the early phase of this outbreak, the number of new cases in Toronto was doubling approximately every 4 days. Today, the rate of infection has decreased to 1. This means that each person infected with COVID-19 is infecting one other person on average. Now, we see the number of cases in Toronto is doubling every 7 days. This suggests the rate of infection in our city is slowing down and that physical distancing and self-isolation are having a positive impact. They're having the desired impact. However, while we believe our local curve is flattening, we are not yet seeing a steady decrease in the number of new cases or new hospitalizations each day. This means that we have likely not completely passed the infection peak. As is the case with any outbreak, we will only know when we have reached this point after it has occurred and our local cases begin to decrease. I realize this is frustrating because you have been practicing physical distancing for 2 months now. I know it is also difficult to see other cities starting to relax restrictions, and you may be wondering why we're not doing this yet. We all want to get back to enjoying our city. The reality is that COVID-19 does not impact all communities in the same way. Each community must look at their own unique circumstances to inform their own approach for reopening their city safely. When our local COVID-19 infections begin to show a consistent decline, we can then start to ease our restrictions to get back to enjoying our city. In closing, I want to thank you all for continuing to do your part to reduce the spread of COVID-19 by taking the public health measures we are asking you to do seriously. Please continue to stay home as much as possible, stay safe, and take care of each other. I'll now hand it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. I'd like to begin my remarks this afternoon by acknowledging that today is International Firefighters Day, and that this week also marks the beginning of Emergency Preparedness Week. As your Fire Chief and General Manager of Emergency Management, I have the privilege of witnessing the service of both our firefighters and our emergency management professionals every day. Our firefighters in Toronto respond to emergency incidents more than 300,000 times each year and fulfill our shared commitment to courage, compassion, and service in all that they do. Clearly, Emergency Preparedness Week in Canada this year brings with it some additional visibility as we all work to manage the COVID-19 pandemic. Our EOC, operating under the leadership of our emergency management team, has been operating continuously for 55 days in response to COVID-19. I extend my sincere thanks for all that our fire service and emergency management professionals do each day. You make us all very proud. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. Our city crews were hard at work over the weekend, repairing more than 7,700 potholes on Saturday. This was the first of 3 pothole blitzes that are scheduled in the month of May. The next 2 will be held on May 9 and May 23. I'm also pleased to advise that our solid waste team will resume regular yard waste collection this week. By fully resuming this seasonal collection, the city is helping residents continue to stay home as much as possible by enabling gardening and outdoor work. The resumption of yard waste collection services also coincides with the reopening of garden centers. We are seeing increased levels of yard waste being put out for collection during the COVID-19 pandemic. As of April 25th, our solid waste crews have collected 11,000 tons of yard waste. This is 3,100 tons more than what had been collected at the same time last year. Garbage and blue box material collection levels remain fairly stable. Please put your yard waste out before 7 a.m. on your regularly scheduled garbage and yard waste collection day. If your yard waste is not picked up on the day it is put out, please leave it out until it is collected. There's no need to call 311 to report a missed collection. Please use a yard waste bag if possible. Otherwise, a rigid, open-top container can be used. Brush and branches should be secured in bundles no longer than 1.2 meters or approximately 4 feet, no wider than 0.6 meters or approximately 2 feet, and no heavier than 20 kilograms or about 44 pounds. As a reminder, as a result of COVID-19, the following solid waste management services continue to be impacted. Drop-off depots are closed to the general public. Toxic taxi services and household hazardous waste drop-off are suspended. Bin exchanges are suspended, and all community environment days scheduled in April, May, and June have been cancelled. The collection of garbage, recycling, organics, and of oversize and metal items has not been impacted and will continue as scheduled. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Just before we go to questions, on the line from City staff, we have Janie Roma from our Parks, Forestry and Recreation Department, Marianne Bedard from Shelters, and Paul Raftis from Long-Term Care. First question is to Austin Delaney from CTV. Austin, go ahead.
Hello, my question is for the Mayor. Mr. Mayor, I'm at a for-profit childcare center today. It has about 160 clients. It fears it will not make it through this crisis. It's asking for help from the city. It's asking for a couple of things, maybe a break on taxes, and also for some of the money for the provincial grants that go to the nonprofits. Any idea if there's some help on the way for this kind of a situation?
Well, I can't speak for the province, obviously, with respect to how they choose to apply their grants. I can say that it is something that we're going to have to take a look at. We were discussing this morning one of the most important components beyond things like public transit to the successful reopening of the city when that day comes on a wide scale is going to be the availability of childcare for the children of those who have to go to work, either essential workers or those who are going back to their jobs. So that those are the kinds of questions that we can take on board in terms of the ability to be helpful. I suspect most of the help that could be sent their way due to the regulatory structure and due to the tax structure is help that would come from the other governments, but I'm certainly prepared to take a look at it.
Just as a follow-up, Mr. Mayor, I'm not sure if I got it right, but the way it's been explained to me, the province gives the city grants, the grant, and the city then decides where it goes to, and the city has decided it goes to non-profit as opposed to profit. Could that change?
That has been long established city policy, and any change to that policy would have to be made by the City Council, and I think the City Council would have a responsibility, as much as it's long established policy, to see what the effect of this highly unprecedented pandemic has been on the availability of childcare generally, recognizing the city's policy over time has focused on the nonprofit and city licensed, city-run childcare. But it's one of those things I think we're going to have to take a look at, just as we look at how childcare is going to be and must be available to all people, and we can't afford to have a lot of spaces lost because we were short to begin with.
Okay, thank you. We'll go to Jeff Gray now from the Globe and Mail. Jeff?
Oh, hi. Yes, I wanted to ask for clarity about the clearing of encampments where homeless people are living. Last week there was an announcement about 125 apartments, and people were being offered housing by outreach workers. Now we're hearing that people are being told to leave, or being warned that they'll be told to leave, and not without any such offer. Can someone clarify just what the policy is on how that's working?
Yeah, Jeff, we'll go to Marianne Bedard, who's on the line. Marianne, can you answer that, please?
Yes, Jeff, thank you for the question. I think taking a look at how we provide services to people who are living outside has been a key priority for the city. We know that those people are at greater risk because of the lack of access to sanitation and sort of basic wellness capacity in outdoor locations. So we have been concentrating on providing outdoor space, indoor space for those people. And since last week, we have made offers and moved 68 clients into the interim housing that we have in Midtown Toronto, and we continue to move another 60 clients in over the next few days. I will confirm that we are not clearing any sites where there are people who remain who have not received an offer of some sort of indoor placement. It is important, and we do post sites where we know we're moving people, because we have to post in order to remove debris. So knowing that we were moving large numbers of people last week, we did post the sites that we moved people from, so that we were able to go in and clean the sites of the debris that those people left behind. We will not clear people who are actively on the site who have not received any offer of an indoor placement.
Okay, thank you. If I could ask another question just to Dr. de Villa, I think I wanted to ask about contact tracing. The Premier's roadmap to reopen talks about getting contact tracing, I guess the initial contact, getting that done within a day in 90% of cases. Are we achieving that? Is Toronto achieving that now, or is there a plan to get to that point?
So there is a plan that is underway to get us to that point. We're conscious of the fact that in order to be able to ease public health measures and move from COVID response to more COVID recovery type activities, that we need to make sure that we're able to effect that case and contact tracing, very important work of public health, in a very timely fashion. So there is a project underway, several different opportunities that are being explored to get us down to as timely a case and contact tracing endeavor as possible.
Okay, thank you. We'll go to Mark McAllister from City News. Mark?
Thank you. Mayor Tory, if you would, you took the time today to praise residents for distancing, saying people are getting it. Obviously, yesterday we saw a hint of warm weather over the weekend. There were more people out. Just wondering, there still has been some criticism over some of the measures that continue to be taken. Is there a better middle ground between closing parks and offering 10 urb TO hotspots to provide more space for people to enjoy the outdoors now that it's getting nicer?
Well, first of all, the 10 TO hotspots to relieve any pressure that exists and ensure safety of pedestrians and cyclists have now already expanded to 21. We said we were willing to go up to 100, and frankly, if there were places that were identified beyond 100, we could go there too. There are 88 others hotspots which have been suggested by citizens and others, and the public health staff, together with transportation, are in the midst of reviewing those now. And I continue to believe that while we have not ruled out, and in fact are carefully studying post-pandemic alternatives to make sure there's adequate open space and safety and flexibility for pedestrians and cyclists and others in the city, that this is a sensible, rational way in which to deal with this in the meantime, as opposed to the very random suggestions people had, if you go back to closing down certain streets they identified right from day one, where you would go there today and find there is no congestion problem whatsoever. With respect to people and their physical distancing and the continued constraints that exist in that regard, including the bylaw that I put in place and that was confirmed in place by City Council last week, I would just say that I follow the advice of the Medical Officer of Health. You'll see that the enforcement people have chosen to take a reasonably light hand, I think, in view of widespread compliance with the bylaw, and I applaud that because I like to think that's the right way to go in a city where people are cooperating. But the decision made to lighten up on some of that in terms of the law and what it says and what it provides for will be based on advice I'll receive in due course, I'm sure, from the Medical Officer of Health, because we've relied on her advice all the way through.
Follow-up, Mark?
No follow-up, thank you.
Okay, thank you.
No, thank you.
Okay, we'll go to Matt Bingley now from Global News. Matt?
I just have a question about the number of new infections that you're seeing. Is there anything in the data that sort of suggests where these infections are primarily coming from, like some sort of pattern that you're able to determine?
So there isn't a specific pattern per se. We do know, and I have reported several times, that there are cases that are clearly through community spread. And we also know that we have a particular circumstance in congregate settings, particularly those where it is very difficult to implement physical distancing just by virtue of the level of care and the nature of those settings. So long-term care homes would be a classic example where it is extremely difficult. Once you've got a case in the environment, you are likely to find others. So these are the kinds of things that we do see in our data. I think the only other thing that I would mention is that the highest risk continues to be being a household contact of a case of COVID-19. That's where we're seeing the most cases when we look at our data on what's happening in our city.
And just my second question just has to do with the way that the data is presented. Every day you've been coming out and giving the cumulative case count, and I'm just wondering why it's not the active case count, so we can gradually see, where we probably are more accurately at right now.
Sorry, what is not being presented? I didn't. The sound went a little off.
Oh, sorry about that. I'm just wondering, we've seen the cumulative case count and not the active case count. So it's, whereas New Brunswick keeps on sort of showing where they are able to see cases go down, we're not really seeing that as much as outside of, recovered cases. I'm just wondering why you don't present them as active cases as that you're tracking.
So at this stage, when we're presenting the data, we're presenting that which we believe is of most interest to members of the public. However, that being said, what I present here is only a small piece of that which we have, and there is much more information available on our website for people who are interested in delving a little bit deeper and in understanding more of the nuance in respect of what's happening in our outbreak. Those data are publicly available, and I would encourage people to visit our website if they're interested in understanding the specifics of the outbreak beyond what I've provided, every day here at the briefing.
Okay, thank you. We now go to Morgan Campbell from Global News. Morgan?
Thank you. This question is for either the mayor or the medical officer of health. We spoke to a COVID positive woman who claims that she was told by staff.
Sorry, Morgan, we appear to have lost you. Could you repeat your question? Okay, we'll come back to you. I'm sorry. let's go to Mike Crawley now from CBC News. Are you there, Mike?
Yeah, hi, I'm here. Can you hear me?
Yes, we can. Thank you. Go ahead.
So my question, first one is for Dr. de Villa on contact tracing. I'm just looking for some clarity on what the province's actual target is, because it says 90% of new COVID-19 contacts being reached by local public health officials within 1 day. What's your understanding of what exactly that benchmark means? And follow up a little bit on the question that Jeff Gray asked you is how far away, I guess, is Toronto from being able to hit that target?
So with respect to the question, you're right. It requires a little bit of delving into, and I can tell you that my team is in active conversation with our colleagues at the province to ensure that we are all on the same page in respect of understanding what that means. Contacts can only be identified, of course, in relation to a case. So the way I understand it is that what we're trying to do is effect the most timely follow-up, first and foremost on the case, and then have that conversation with the case so that we can understand where they might have been during their infectious period and who they may have exposed, those being the contacts, so that we can then in turn follow up with those people and make sure that they are isolating or quarantining appropriately so as to minimize further transmission of the virus. So to my mind, the real goal of contact tracing, case and contact tracing, particularly as we're trying to ease public health measures, is to do that as quickly as possible. And the current provincial guidance suggests that that should be done within 24 hours, I would imagine, of contact identification. It's difficult to do that otherwise. How close are we? We are actually, surprisingly quite close to it here in Toronto. There are some areas that we absolutely need to work on, and we are working with partners on ensuring that we're getting lab information as quickly as possible. Sometimes the lab information is not as complete as it could be. It is difficult to follow up with patients, for example, if we don't actually have a valid phone number. So these are the kinds of things that we need to work with our healthcare partners who are doing the testing to ensure that those data are being collected so that we can follow up in that very timely fashion and make sure that we're providing the best case and contact tracing so that we can ease public health measures.
Thank you, Doctor. And my follow-up is for Mayor Tory. Again, it's a bit of a follow-up to Jeff Gray's question about people living in homeless encampments in tents. What is the plan for the future in terms of making any more housing available for people living in tents?
We have been actively engaged for some time now, which, for example, resulted in the housing in Midtown being made available for those who have been moved, several dozen already, into that more permanent indoor space rather than sleeping in encampments. The modular housing initiative that you saw approved by the City Council last week, which will be ready in fairly short order relative to the time it normally takes to do these things, is another option that is a real possibility for us for this population. And we'll be leaving no stone unturned in order to make sure that we find housing that is a better alternative to the encampments, which can then be cleared, and also that we find solutions that are more permanent, because that in the end is the real objective here, which is to find permanent, stable housing for these people. And I think we've had the opportunity during this pandemic to identify some ways in which we can both house people in the short term, but also find more permanent solutions for them at one and the same time.
Okay, thank you. We'll go to Dave Ryder now from the Toronto Star. Dave?
Hi. First question is for Mayor Tory, and that's you mentioned on CP24, I think this morning, that you've been flayed, heavily criticized over the decision to close High Park. And you mentioned in your remarks that most people seem to agree with you, or at least were following the rules. I'm just wondering if you have any second thoughts or any idea when the park will reopen, and also your reaction to the fact that at least a couple of people did not obey the rules and in fact were videotaped climbing and taking pictures in the trees overnight.
Well, I think the people that climbed the tree, and I can't imagine what appeal the concept of having a beer in a cherry tree in the middle of the night has and then posting it on Instagram. I don't get that. But at the same time, I think they would be excellent candidates on Toronto's behalf to be nominated for a Darwin Award for their behavior. Having said all that, I think the vast majority of people, the vast majority, with perhaps the exception of those two, either stayed away from the park entirely, which was what we were trying to do, not because we're killjoys or because we didn't want people to enjoy the blossoms, but because we were nervous on the advice of the medical officer of health about the crowd scene and what that might do to spread the virus, and people thankfully stayed away. Do I have any second thoughts about that? No. Because I believe that it was the right thing to do in the circumstances. I am certainly exploring if we're not able to open the entire park in the next couple of days, and there's some chance that the full blossom season could be over by then because it is short, as to whether we could reopen part of the park, but it was complicated for us to think about a partial closure from the beginning, which is why we closed the whole park. So we'll see how things unfold, most particularly the length of the blossom season, which isn't expected to last beyond some day later this week anyway, in which case the entire park will be reopened as soon as we reach that time.
Thank you. My follow-up, it could be either Mayor Tory or Chief Pegg, whoever's more appropriate. And that's just that we've now seen what I'll call baby steps, which is resumption of leaf collection. And then today we heard the news about the community gardens reopening. Obviously, you guys are following a plan. I'm wondering if you could just share what the next couple of steps will be to maybe help give people kind of hope for, if we continue to follow the rules, what else will get reopened.
We haven't yet identified the next steps in Toronto's case, and we're very much working together with the province, which I think is going to have some further things to say this week. They've already got a couple of areas that are allowed to do some degree of preparation for an opening that might come in a couple of weeks. But if you look at their plans, they've indicated they will have more to say this week. We are engaged in close consultation with them. We approve of their measured approach based on public health numbers and based on public health trends. And I think the Premier has been very forthright and emphatic in saying that today, that while people can talk about next steps and next groups that might be subject to reopening, all of that is qualified by the need for us to see the kind of improvement that he has cited, that Dr. de Villa has cited in the numbers. And so we're hopeful, fingers crossed, that day will come very soon, but it's going to come when it comes. As I said, it should come as quickly as possible, but it may not be possible for it to always come quickly when it comes to different sectors.
Okay, thank you. We go to Christina Tenaglia now from CP24. Christina?
Unmuted here properly. Hi there. Most of my questions here have been addressed, so just a follow-up for Mayor Tory on the guys caught on the Bloom camera at High Park overnight, hanging off the trees, taking selfies, and it appears from the Bloom camera images and video that someone is urinating. I'm wondering, we're here outside of High Park. We see a lot of Toronto police officers here conducting enforcement. Are you satisfied with the level of enforcement and surveillance, considering, Toronto police is using its resources to keep an eye on this park, and clearly 2 people overnight were able to make their way in and spend some time there?
I would say in a city of 3 million people and on a 24-hour clock, that the fact that 2 people chose to engage in kind of pre-evolutionary behavior of this kind is something that I wouldn't be critical of our security arrangements in that regard. And obviously, they having done that, will be anxious to keep an eye on things going forward, because there's always copycats who, for whatever reason, want to engage in similar behavior. But I think that the public have been extremely cooperative, and I thank them for that. They've been very understanding, including the neighbors of High Park. And I just hope that will continue through a couple of more days, when the blossom season will then be over, and we can look forward to enjoying the blossoms in person next year, and look forward to celebrating the really good, understanding, patient behavior that everybody else engaged in, except 2 people out of 3 million who, to me, have a couple of screws loose, potentially.
Okay, Christina, did you have any follow-ups?
No, thank you very much. Thank you.
All right, let's go back now to Morgan Campbell from Global News. Sorry about that, Morgan. Let's try again.
I think that was an audio issue on my end. My apologies.
Not at all. Go ahead.
My question is for either the doctor or the mayor. We spoke to a COVID-positive woman who came to the hospital. The patient transfer ride home would be rather expensive, in the ballpark of $1,200. Cab companies refused to take her home. She chose to walk home nearly an hour because she didn't want to put her family at risk. what advice do you have for COVID positive patients as they're discharged from hospital? And why hasn't the city developed some type of policy or procedure for patients back home?
Well, I'll start by saying that we have been engaged in active discussions to try to identify cab drivers who are willing to take patients subject to appropriate precautions, and those negotiations and discussions have been taking a bit longer than expected, because I think it's reasonable to have the hope that we could have some cabs that could be called in an instance like that by the assessment center to take these people home. It isn't reasonable to expect they're going to walk for an hour. I can't comment on why that was the only option that was available, but I will just say that I even think today, if at least one of the major cab companies, if they were to receive a call from somebody who said, I am COVID positive, I have been tested, and I need to get a ride home from the assessment center, they have drivers, I'm told, that would be willing to undertake that responsibility. And I guess in this case, that didn't happen. But I think, you know, those discussions are aimed at making sure that there is that option available for people who are in that circumstance.
Now, have we looked at the potentially doing at-home testing to limit the amount of people that's going, into hospitals or into these areas, that would, limit the amount of time they've spent out in the community to maybe curb some of these issues, especially if you have people more in the vulnerable sector or maybe who have a lot of money? And is there a way to even look at maybe setting up a way that patient transfer services could be utilized?
So when it comes to other methods of testing, that's certainly one of the issues that many scientists are absolutely looking at. And I know that determining what tests are available for use for diagnosis is something that falls to our federal counterparts. And I know that they're actively looking at this. The challenge, of course, is that this is a new virus that we're dealing with, a virus that was only discovered at the beginning of January. So tests to actually discover the virus or to find the virus, particularly those that are available for use at home, are still very much under development and or under testing to make sure that you're actually getting an appropriate and valid result when you use those tests. But I will say that when it comes to people commuting or transporting themselves around, we have some advice up on our website to help people as they try to make sure that they minimize the spread of disease should they become diagnosed with COVID-19. And first and foremost, for people who realize that they have an infection, just at the moment that they realize that they're trying to get home, we prefer that they take private transportation, drive yourself where possible. If not, the next best thing to do is to have a household member or a friend take you home. The individual who's sick could wear a non-medical mask to try to reduce the likelihood of spread, open the windows to the car, and clearly try to take the most expeditious route so that person can get home and isolate appropriately and minimize the spread of disease.
Okay, thank you very much. That concludes all the questions. Thank you for tuning in, and we will see you again tomorrow at 3:45.